If you or anyone around you has diabetes, then you need to watch this video to the end. Hi, it's Head Talk. Today I want to share one of the most common mistakes that people make when it comes to managing their sugar levels, and it's all about food. So I was in a counseling session with one of our patients recently. He came in asking why his blood sugar level was not under control. And so we decided to have a complete review. We started with the medications, it was perfect. Then asked about his activities. He's moderately active, quite good for his age. Then I asked about his diet. That was when I got the shocker. He proudly said, "Oh, I try to eat right. In fact, I eat beans most of the time because it's proteinous, and sometimes I add Irish potatoes because they are not sweet like yam or plantain." At that point, I found what the culprit was, and that was his diet choices. Now, let's pause and look at beans. Yes, beans may be a good source of protein, but there is something many people don't realize about beans. 60% of the calories in beans actually come from the carbohydrate content. Protein is just about 21 to 25%, while the rest is made up of fiber and small amounts of fat. And so even though beans are healthier than maybe white bread or rice, they are not a free pass per se, especially for people with diabetes. Eating beans 3 times a day can still push blood sugar up because the carbohydrate portion will eventually be broken down into glucose. And let's not forget potatoes. Irish potatoes may not be very sweet to taste, but it contains starch. It's very high in starch. And starch is just another form of carbohydrates, which will spike blood sugar very quickly, especially when the portion eaten is so large and without fiber and protein. So, what's the best way to eat as a diabetic? One of the simplest and most effective tools is the diabetic plate method. Imagine your plate and divide it into 2 equal halves. The first half is supposed to be filled with non-starchy vegetables like spinach, okra, cabbage, garden egg, cucumber, green beans, or carrots. The other half should also be divided into 2, giving you 2 quarters. In 1 quarter, fill it with lean proteins such as fish, chicken, eggs, or even beans. Then on the other quarter, it should contain healthy carbohydrates like rice, yam, potato, corn, or whole grains. This way, carbohydrates will be controlled, your protein will also be balanced, and the vegetable will help slow down the sugar rise. The tips to bear in mind actually when it comes to diabetes control is the fact that carbohydrate is not your enemy, but the portion you take at a time matters. And then you need to pair the carbohydrate with protein and fiber to slow down the sugar spikes at the rate at which the sugar content of your food is released into your body. Thirdly, there should be variety. You don't have to stick to one type of food all the time just because you think it's safer. You can go around different types of food, but make sure it's paired appropriately using this diabetic plate method. So the next time someone tells you that beans is only protein or Irish potato is sugar-free, please do well to correct them. Achieving adequate control of diabetes is not just about medication. The foods play a very important role. Please share this with your loved ones who have diabetes or anyone who you think could benefit from it. And remember, it's not about perfection, it's about striking a balance.